Good afternoon, everybody. I welcome you to the webinar. Concurrently, it's jointly hosted by the Jiann-Ping College of Public Health and the Coastal Health District Academic Health Department. I'm pleased to introduce an alumnus and a major public health professional, Dr. Chris Rustin. Dr. Rustin duly serves as the Deputy Commissioner for the Georgia Department of Public Health and the Public Health Administrator for the Chatham County Health District, Coastal Health District. In the at the Department of Public Health, he assists the Health Commissioner for the state by overseeing the public health programs and coordinates the statewide COVID-19 and monkeypox operations. At the Chatham County Health District, he provides oversight and management for the local health department services of Chatham County and oversees the district's infectious disease program. I will turn it over to Dr. Rustin and thank you all for joining. If you could please mute yourself and we'll have questions and answers at the end. With respect to time, we do have a hard stop at 10 till, so I'll be asking for questions after Dr. Rustin presents. Thank you, Dr. Rustin, for your time today.
No, thank you, Dr. Mace, and thank you, Georgia Southern, and for the opportunity. And we certainly value our academic health department partnership between the Coastal Health District and Georgia Southern University. Today, I am going to talk about sort of the 2022 legislative session. There was a lot of activity this session and a lot of potential or bills that were introduced that eventually got signed into law that impacts public health. And what I want to do today is kind of go through a little bit of a civics lesson for folks who may not understand the process on how bills are actually introduced and eventually become law. And I will go through some of the bills that were passed this year and signed into law, and a couple of bills that were not signed into law. So let me do this real quick. All right. Just to give you guys an update, the Department of Public Health has an Office of Government Relations, which essentially serves as the agency's representation at the Capitol. This particular office tracks a number of bills throughout the legislative session. And just to give you kind of an idea of how busy they are, in 2020, there was 186 bills that were being tracked and monitored, with 43 of those bills actually having a direct impact on the public health agency as a whole. And when I say public health agency, I'm referring to the agency health departments, the Department of Public Health in Atlanta, the headquarters, all of that is inclusive. In 2022, in comparison, this past session, there were 192 bills that were being tracked, with 89 of these bills considered direct impact to public health. So there was a lot of activity this session. The team that monitors this was extremely busy. And as you can tell, each one of these bills have to be reviewed. They have to be analyzed for potential impact. And then we have to decide if this is a bill that we want to support, not support, work with the author of the bill to try to clarify better our position on whatever the issue is. And so it is a very busy time, even though the session is somewhat short. And I'll talk about that in more detail as we move on. But I do want to start off with a civics lesson. Not knowing, some people have a great understanding of how bills are introduced, how they become law. Others may not have quite a good of understanding. But as we all know, our system of government is broken up into three branches: our executive branch, legislative branch, and our judicial branch. Primarily, the agency, the health departments, the State Department of Public Health falls under the executive branch, which is headed by the governor of our state. This includes all state agencies, state boards, and most importantly, the Commissioner of Public Health is appointed by the governor in our state. And so Dr. Toomey is our appointed commissioner from Governor Kemp. The legislative branch makes up the elected officials. There's 180 House of Representatives and 56 senators in our state. And so as you can imagine, it can be rather difficult to get a bill through. A lot of bills are introduced, but not many of them actually make it to the finish line because of all the ins and outs that go into a bill becoming a law. And obviously our judicial branch is our court system. From a public health standpoint, let me see, I got to move something off my screen. There we go. From a public health perspective, the U.S. Constitution, the Bills of Rights, and our state constitution grants a lot of rights and restrictions to the public health agency to protect the health and welfare of our citizens. Article 3 of our state constitution vests legislative power to promulgate rules in the state or laws in the state. And those laws, again, are promulgated as a bill in the House of Representatives or the Senate. Ultimately, as a public health agency, or really as any government agency, we have to weigh our power as a government and the need to protect the public's health with protection of individual rights. All of our laws in Georgia are codified under the official code of Georgia, generically known as OCGA. This provides legal authority and all of the enabling legislation in which public health rules and regulations are based. And so one thing that a lot of people don't realize is that in order for the department to adopt rules and regulations, we have to have enabling legislation that gives us authority to do that. And so that's where these laws come in place. And sometimes the laws direct us to do something. Sometimes it requires us to adopt regulations that are then enforced potentially through our health departments. Most of Georgia's public health laws are found under what's called Title 31. Which makes up most of all the public health codes in the state. But there's a few exceptions. Food safety is actually found under Title 26, which is a different code section. And then Title 12 is where a lot of our environmental codes are located, related to wastewater disposal, protection of wetlands, drinking water, and that sort of thing. And so these are sort of the major code sections that we typically work with as a public health agency, but there is others that we are involved in. There's a lot of cross-pollination with other code sections. So the legislative process, all legislative sessions in Georgia begin on the second Monday in January and runs 40 legislative days. These days are not consecutive. And so 40 days can actually take 3 to 4 months because when they're in session, they're working, but they may actually recess session to have committee hearings and the clock stops. So the clock stops and starts a variety of times, but it's 40 legislative days. And so usually what happens is that first week, the governor gives his State of Union address, and then agencies are required to present their budgets to the various budget committees that are being heard in the House and Senate. While our legislators are considered a part-time legislator, most of them work throughout the year. They serve on various committees. And so even though they're considered part-time, in most cases, they're working or on the clock throughout the year on various issues throughout our state. One thing that I think is critically important to know regarding a bill is that all legislation must pass from one chamber to the other. A chamber is the House or the Senate. By the 30th legislative day, or the bill is considered dead, and that's called sine die, which is essentially Latin for conclusion. There is some workarounds on that. If a bill has passed over by the 30th day and another bill has not passed, it could be attached as a rider to that bill. So there's some workarounds to this, but in most cases, a bill has 30 days. If it doesn't make it across the aisle in 30 days, it's usually dead for that session, and it can be taken up the next legislative year. So what you see happening is on that 30th day, it's very, very busy. That day usually goes to midnight, or in some cases later than that. But it's a very busy day, and a lot of activity is occurring to try to get bills passed so they can get transmitted over to the other chamber. Once a bill is introduced by a legislator, any bill can be introduced by a legislator in the House or the Senate. The bill is basically read on the floor of the House or the Senate. That's called first and second readers, and then it's immediately assigned to a committee. Most of the health-related bills are usually assigned to the Health and Human Services Committee. In some cases, if they're environmental, they may be assigned to the Natural Resources Committee. We've had bills assigned to the Regulated Industries Committee, Government Affairs Committee, but they always get assigned to the committee. Once they are in committee, the committee considers the bill, they study the bill, the impact of the bill on Georgia, on the citizens, on an agency, and they usually allow testimony from subject matter experts. These subject matter experts may come from state agencies, they may come from the private sector, and they'll usually allow testimony from interested parties at that point. So the committees are the ones that do a lot of the work to determine if the bill needs to actually move forward to the next step. What the committee can actually do is pass the bill. They cannot pass the bill, or they can pass it with changes, which means they've added an amendment to the original version of the bill that was introduced, or a substitute. In the House, they can report without recommendation. They basically just report on the bill, but really they don't take action. Or they can actually hold the bill, meaning they're just going to hold it, and they may decide to hear it at a later time in the session, or they may not decide not to hear it. And so what a legislator obviously wants is the bill to pass. And so that's usually the goal for any legislator. If the bill does pass, then it's assigned to another committee called the Rules Committee. The Rules Committee, probably most people will say, is the most powerful committee in the legislature, because the Rules Committee is the gatekeeper. The Rules Committee decides what bills actually go to the floor of the House or the floor of the Senate for a full vote of that chamber. And so that committee is very important, very powerful. A lot of bills go to the Rules Committee, but not every bill gets out of the Rules Committee. And so that once it gets to the Rules Committee, we usually wait to see if it's going to get out of rules onto the floor for a full vote. Once the bill does go to the floor and a vote's taken, if it's passed by the full chamber of the House or the Senate, it's then sent to the other side. It's transmitted to the other chamber, and the process starts all over again. And you will see that once that happens and it starts all over again, if the House and Senate votes to approve the same bill, then the bill goes to the governor. But one thing that's important is both chambers must agree on the bill language, and sometimes that's what gets bills sort of held up. A bill may get locked, the House may vote on a version of a bill that the Senate doesn't agree to, or vice versa. And so both chambers must agree, and a lot of times they'll put a committee together to hash out disagreements. But if they can't come to an agreement, the bill does not go anywhere. It ends up, in some cases, dying on the vine. But if the bill does make it, as you can see, it has to go through a lot of steps before it finally makes it. If it does make it, it's sent to the governor's office, and the governor has 40 days to sign a bill into law or to veto the bill. The governor can also not sign the bill or veto it. If a governor chooses not to do that after 40 days, the bill automatically becomes law. That happens occasionally. Generally, the governor will either sign it into law or veto it, but occasionally they will not sign it for a variety of reasons, and it becomes law if they don't sign it after 40 days. And then once that happens, if the bill becomes a law, that particular law usually directs an agency like the Department of Public Health to implement the law in some form or fashion. And that implementation could mean creating a new program. It may mean enforcing something, as in environmental health, where we enforce food safety or other public health safety rules. And so it really directs the agency on what they need to do next for that particular bill. So a lot of work goes into that. Our agency is usually involved tremendously throughout this process, especially if it's a bill that impacts the Department of Public Health. Okay, now moving into this past session, I just wanted to give you a little bit of civics lesson to kind of level set on sort of the process. Moving into the 2022 session, there were 4 agency bills, and what this means is the Department of Public Health has worked with the governor's office to recommend legislation that we would like to see passed. As I stated earlier, an agency can't submit a bill. They're not an elected official. We have to work with the governor's office, who would then have a legislator submit a piece of legislation on the agency's behalf. These were the 4 bills that the agency supported this year, that the governor's office supported. And as you can see, 3 of them passed and 1 of them did not pass. Childhood lead poisoning, and I'm going to explain these in more detail. EMS Rat Back, Smoke-Free Air Act and vaping, and filming patients in healthcare facilities were the 4 bills that the agency supported and the governor's office supported. And this is just a litany of bills. As you can see, these were direct impact bills that passed. I'm not going to talk about all of them today, but there was a lot of bills related to professional counseling, mental health parity, vaccinations. There was a raw milk bill. There was a couple of food safety bills, HIV modernization, food delivery app study committee. There was quite a bit of direct impact bills that passed that we're working to implement as we speak. The childhood lead poisoning bill was originally started off as House Bill 1355. A little bit of history on this particular law. The law that was in place was written in 1994 when lead poisoning at the time was considered, if a child had a lead, essentially a lead exposure of 20 micrograms per deciliter or higher, that was considered safe at that time. And as you can see if you've kept up with lead poisoning research, there's no safe blood lead level of lead in anybody's body. And in children, CDC now recommends if a child tests at 3.5 micrograms of lead per deciliter or higher, that they're at risk of some public health intervention needed, or they're at risk of poor outcomes. So a public health intervention is needed. We worked very hard with the governor's office and the legislator to align Georgia's law with the most current national recommendations and national science, and we're successful in getting this bill passed. And so now, if a child tests at 3.5 or higher, public health can get involved to take some kind of action. That action may require us to enforce the lead law, which would require a landlord to mitigate lead hazards in a rental property. The one good thing about this bill is, in addition to it passing, we were appropriated almost $2 million to hire additional lead inspectors throughout the state and additional equipment to implement this law. So we're very, very happy that this law passed, and we're actively working to implement it and hire new staff now. And really, we hope to reach more children that need public health services to prevent unwanted lead poisoning. The Smoke-Free Air Act and vaping. This is one of the bills that did not pass. Unfortunately, this bill passed the House, but it did not get called up for a vote in the Senate. The reason this was important, the current Smoke-Free Air Act in Georgia was adopted in 2005, and it only includes essentially tobacco smoking products. Vaping wasn't even invented at the time when this bill passed. And so right now in Georgia, it's illegal to smoke cigarettes, cigars, pipes in a public setting, but it's actually legal to vape in a public setting, unless a city or county adopts a local ordinance. City of Savannah actually has an ordinance that prohibits that here. We tried to get vaping added to the Smoke-Free Air Act because we get a lot of complaints at our health departments on vaping in restaurants and in other public settings. But unfortunately, this bill didn't get called up on the Senate side, and it basically didn't make it. It didn't make it to the last second. We watched this particular bill all the way up to midnight on the last day, and it just unfortunately didn't get called up. But hopefully we can bring this up again next session and get this law updated so we can add vaping to that. The EMS fingerprinting bill, which was Senate Bill 404. This bill, as I mentioned earlier, it's called Rat Pack Bill. I'm not quite sure why they call it that, but DPH license all medics in the state of Georgia. This is all EMTs, advanced EMTs, cardiac care technicians, and paramedics. They're required to be licensed by the state to be able to practice this type of medicine. Currently, or prior to this bill, a criminal history check is completed at initial licensure of all EMS personnel, but DPH was not notified if a licensee is convicted of a criminal offense after that initial licensure. What this bill actually allows the state to do is to participate in a federal program where the Georgia Bureau of Investigation would be authorized to retain fingerprints of all licensed medics, so DPH can then have sort of an ongoing review of the individual's criminal history. This is important because if someone is convicted of some crime in another state, and this, if you think about a paramedic or an EMT, they're with you during your most vulnerable time. They're with you when you're in the back of an ambulance in some cases. And we want to make sure the individuals there that we understand what their criminal history is. And this bill actually allows us to keep up with folks who unfortunately may have committed a crime after their initial licensure. And by knowing that, we can actually pull their license and prevent them from continuing to operate. So this was a good bill that was passed. The Filming and Health Departments bill, Senate Bill 539, this was passed and signed by the governor. Prior to this law, we were faced with individuals showing up into health departments and filming patients going into the clinic. Under the current law, they could, or under the previous law, they could do that. And as you can imagine, there's a lot of stigma around certain types of procedures that people may seek in a public health department. They may be there seeking HIV treatment. They may be there seeking STD treatment. And to have someone go into a public health lobby and record patients actually has caused quite a bit of problems. I mean, we've had police get involved, we've had patients get angry, and unfortunately, under the previous law, there was literally nothing we could do about it. This particular law was passed to prevent the filming of patients or recording of patients without their consent within a health department clinical setting. And so we felt like this was something that would benefit our clients that come to the health departments and make them feel more safe in our various health department settings. And unfortunately, we've seen this, there's various groups around the country that challenge open records laws. They challenge the right to film in public spaces, and they come into the health department and do this, and it just really creates chaos for some of our health department clinics. And so we are happy that this bill passed. It is a limited carve out in the law, but it does prevent this from happening within our clinics. This particular bill, the Mental Health Parity Act, received a lot of attention in the state. This is HB 1013. This was a comprehensive mental health reform bill that was put in place. Our role is somewhat limited. Mental health in Georgia is actually overseen by the Department of Behavioral Health and Developmental Disability. It's not the Department of Public Health, but we are involved in a cross-agency team looking at and developing programs that will serve disabled infants, children, and youth. And there's some other agency cross collaboration that's occurring. This match team is one of them, where we'll be looking at unmet needs in children in this state. This particular bill was passed. It was signed very quickly by the governor and is in effect now as we speak. Raw milk sales. As many of you know, if you've been in public health, pasteurization of milk is probably one of the top 10 public health success stories in the world. Many people in the late 1800s, early 1900s got sick from drinking raw and pasteurized milk. And many children died from this, from the various diseases that could be transmitted through raw milk. Georgia's, for many years, did not allow the sale of unpasteurized milk in our state. There was a slight carve out in the law that did allow pet milk to be purchased. Some people purchase milk for pets, although we know that there are individuals that will buy the milk that's for pets and drink it for human consumption. That pet milk had to be labeled as raw and pasteurized milk. But there's been a push recently with a lot of the farm to food movements to allow people the right to purchase raw milk sales. We were asked to testify and provide testimony on the public health risks of raw milk consumption, which we provided. And the original bill would have allowed raw milk sales to occur in grocery stores and restaurants, potentially in schools. While we weren't successful in getting this bill from passing, we were successful in getting it pared down to it's only allowed to be sold for direct to consumer sales at a dairy. And so if someone wanted to purchase unpasteurized milk, they would actually have to go to a dairy to purchase that. We should not see this in a restaurant or in a grocery store or gas station, for example. While there's certainly still a risk out there, we do feel that by getting them to add this, it did reduce the risk tremendously. And other states have a similar law in place. So some states allow the sale of unpasteurized milk across the board, but at least we were able to sort of pare this down to reduce the risk. And this law was delayed, and meaning that it doesn't go into effect until January 1st of 2023, because the Department of Agriculture regulates this, and they needed time to be able to put regulations in place to cover this particular law. Audiology screening. We offer through the health department's audiology screening for our EED services, ears, eyes, dental, which is required to go into school. This bill does sort of expand the use of non-licensed audiologists to be able to offer this service in other settings. And currently, this particular service was only authorized for infants under 3 months old, but it's been expanded to offer it up to 22 years of age to be able to expand this services to more individuals across the state. Food safety was a hot topic this session. This particular bill, I think everybody knows what a food truck is. We've all purchased food probably from a food truck. Those are regulated through the health departments. They're licensed and inspected by our health inspectors. But there's been some confusion about if you're licensed in one county, health department being able to travel to another county, having to get licensed in that county. And there's been a lot of movement by the mobile food organizations to streamline this process. We had a lot of concerns with this, but ultimately we worked out a compromise where if a mobile food operator is licensed and inspected in one county, they can go to another county and not have to get a separate license from the health department, but they do have to notify the health department that they're operating, and they are subject still to inspections by the health department. The way the current law was written was you had to be licensed and permitted in any county you go to. And so this did reduce some of the bureaucratic burden on the industry, but there was a fiscal impact that was not funded on DPH. We've got to upgrade our inspection system, and we're working through that process now to be able to allow our health inspectors the opportunity to be able to do those inspections across county lines. This bill does not go into effect as well until January of 2023, but it was signed by the governor. The HIV Modernization Act, this is Senate Bill 164. What this bill did was modernize the language that was used to describe HIV-related laws in our state. Many of these laws were written in the early 80s, and a lot of the language that was used was had a lot of stigma attached to it. It didn't address some of the better scientific evidence of routes of transmission, and it really prohibited or inhibited our efforts to promote HIV prevention and treatment. And so this law was updated really with the most modern terminology, the modern science, and it hopefully will allow us to do a better job of promoting HIV prevention and treatment in the state. And this is something we've been working on for a number of years, and we're pretty happy that this finally passed and was signed into law. Now, these are a few other bills. The COVID vaccine passport, as you all may know, during COVID over the last 2.5 years, there was a lot of politics around COVID passports about requiring you to show your vaccine card to be able to have access to certain services. This bill was introduced, and it does prohibit state and local governments from mandating vaccine passports. And so we can't require someone to be vaccinated to gain a benefit of a service, to attend an event or anything like that. Private businesses can still mandate vaccine passports or mandates. Some of them still do, but the government cannot. And this bill was passed and would limit our ability to be able to require that. Maternal autopsies is another bill that was introduced and passed, Senate Bill 496. Under this bill, a medical examiner inquiry must be conducted for a death of a pregnant female or one who was pregnant within 1 year of death. The goal is to try to learn, we feel every death can be prevented, and maternal mortality is an issue in this state that we've been trying to address. This hopefully will allow us to learn more about what is causing maternal mortality and to be able to put better programs in place to be able to prevent that. Some funding was added to the DPH budget to fund these autopsies, and they'll be conducted at regional perinatal centers around the state. Ultimately, the goal is to improve maternal mortality in our state, and we feel like this is one way that we can potentially do that. Unmasked Students, this is another bill that was signed that prohibits school personnel, school superintendents, schools from requiring or enforcing students to wear a mask without, basically without parental approval. And this again was another hot topic during COVID. What this does not apply to is public health administrative orders. And so this is a piece that got confused. While it does prohibit a school from just generically requiring masking, if there is a public health reason for a mask, if a student has COVID or is under quarantine and they're issued an administrative order by the Department of Public Health, that masking can be enforced under this law. And I know I went through that pretty fast. There is a lot of bills that were introduced. I'm not sure how we're doing on time, Dr. Mace, but I'm happy to take questions and answer anything I can about what I presented.
Thank you so much. We really appreciate all your good work with the state and with the district. I think we can turn it over to questions. I'll moderate. If anyone would like to ask a question, you can unmute yourself, introduce yourself, and ask your question.
Hi, good afternoon. I guess I'll get started. Mine is less of a question and more of a example, I guess. I am actually one of Dr. Rustin's extended employees, I guess. I'm an environmental health specialist and actually the regional lead and healthy homes coordinator for the West Central Health District. And I am seated in Columbus, Georgia, and I work for Christy Kuriatnik at the state office. So I actually am personally and professionally affected by the change in legislation with the childhood lead poisoning prevention bill. So just kind of wanted to give a personal viewpoint on that because the bill just took effect July the 1st of this year. So just within the last couple months, our action level to actually go out and do home assessments to try to figure out where the lead exposure is coming from for children who have elevated blood lead levels has changed from 10 micrograms per deciliter to 3.5 micrograms per deciliter. So our workload is going to get a lot bigger. Our jobs are going to change substantially. And it was really interesting kind of watching the legislative process kind of unfold as it pertained to our job. So thank you, Dr. Rustin, for kind of presenting that because it is kind of personal to me professionally. And I just wanted to kind of put that out there, not necessarily a question, but just a point of view from a public health professional that actually is affected by these kind of legislative changes. So very, very interesting.
Thank you, April. And thank you for the work you're doing. You know, we do have a lot of staff across the state that are impacted by these laws, and I appreciate you providing that personal perspective on that.
Yeah, absolutely.
Hi, Chris, it's Linda.
Hey, Linda.
I have a question for you. This is maybe a lack of my knowledge of what goes on in the government state lawmaking, but I'm curious. I have my financial management students at the start of my fall course do an exercise where they are asked to come up with ways to reduce the national deficit. And all of those are at national debt, excuse me, and all of these packages are scored by the CBO with 10-year net impacts on the budget. And so I guess my question to you is at the state level, you cited some of the budget impacts for the Department of Public Health, but I was curious how those estimates get produced or how your office kind of contributes to those overall impacts at the state level?
Sure. So Georgia has a state economist, and typically the agencies don't get as involved with sort of projections. That's usually handled by the Governor's Office of Planning and Budget, as well as the Senate and House budget offices. And they work closely with the state economist on those types of projections. As you probably know, the last couple of years, Georgia's budget, we've had a pretty substantial surplus, which is unusual. You know, we don't always have these giant $1 billion plus surpluses, which has actually made it, you know, easier and harder. I think, obviously when you're in a budget flush year, it makes things easier from a budgeting perspective. And we do end up with a lot of new money in some cases. The department came out very good this year and received a tremendous amount of new funding for salary enhancements, for various programmatic enhancements, which is probably the most funding that DPH has ever received in its history. But with new money you get put in a situation where you've got to implement a lot of new programs. You got to hire new people, and all that takes time. We do get involved with, annually we have to provide a budget to the Governor's Office of Planning and Budget on what we expect our needs are. But we are provided essentially instructions from OPB, the Office of Planning and Budget, on the parameters that we can submit. For example, for this budget year, all state agencies are told to submit a flat budget, which means we can't ask for more new money. And in other years, they may say you can request additional dollars. And so our involvement, primarily from an agency perspective, is truly just on the budgeting side. And as far as the forecasting, looking at inflation, looking at all of that type of spending, that's handled at the governor's level, his office, as well as the legislative side, working with the state economist.
Thanks.
I believe Dr. Fung has his hand raised.
Yes, Dr. Rustin, well, thank you so much for your presentation today. So my question here is, are there any upcoming or potential legislation that will come up in 2023 that would have a direct impact on public health in Georgia that you may alert us to pay attention to in the forthcoming year? Thank you.
So I do expect more food safety bills to come up. Food safety is a hot topic. There's a lot of different business options out there that's being explored across the country. We do expect there to be additional, typically when you think of food safety, at least from a public health perspective, we've always had sort of the brick and mortar where you've got restaurants, you've got cafeterias, commissaries. Those have to be licensed, permitted, inspected. And you've got mobile food, the food truck movement. But there's a lot of different business options out there that are being explored in other states, like the micro kitchen concept, which would allow folks to be able to prepare food in their home kitchen. And there's a lot of risk to that you have to consider from a public health perspective, because it's hard to regulate someone's private home and what goes on in that private setting. But that is something that potentially could come up. There's a lot of other business models like ghost kitchens. Ghost kitchens are basically kitchens where when you order food online and you think you're buying it from a restaurant, you're actually not. You're buying it from a company that basically orders the food on your behalf and delivers it. The company has relationships with restaurants. It's called a ghost kitchen because you're not actually ordering it directly from the restaurant. So there's different public health risks we have to deal with, but these different models that are out there are gaining a lot of attention for people who want to open up small businesses. And Georgia is a small business state, and it's something that's supported by the legislators. So we do see that coming up with all these different options. And what we have to do is try to weigh the public health risks against people trying to make an income. We try to find a balance somewhere in between to be able to allow some of these options, but also ensure that we're protecting public health. Also, so food safety will definitely come up. We already are getting inquiries and questions about that. Other than that, I mean, it's hard to say. I think there's going to be a lot of attention. This past legislative session, there was a lot of new programs funded. I think there's going to be a lot of evaluation of those programs on how they're being implemented. And so outside of food safety, looking at my crystal ball, I don't really know what's going to be proposed. We generally start learning about ideas in the fall. And so around October, November, legislators will start calling, asking questions. But it's something I could certainly follow back up on as we learn more leading into this new session.
Thank you very much.
You're welcome.
It looks like there is a question in the chat. Do you want me to read it?
Yeah, if you don't mind.
Okay. So Santio asks, do we have any framework that integrates these bills into the knowledge of public health, academic to public health practice? How are these bills affecting the current knowledge of academic public health? Thank you.
So I think, honestly, this academic health department relationship that we have between the Coastal Health District and Georgia Southern is one great example on how we could sort of integrate this process into, public health knowledge, public health academia. I think, any course any policy level course that focuses on legislative rulemaking or lawmaking, I think would be a wonderful opportunity to partner with public health to try to help, offer guest lectures on that particular topic. This particular presentation is sort of a mix of two presentations that I've given. When we hire new public health staff, especially in the environmental health area, because they deal with a lot of laws and rules, we actually give them sort of a Civics Lessons 101. Because we really don't know where people are coming from. Everybody comes to us with a different type of degree, and some may have more policy level training than others, but we do want them to know, how a law is created, how bills are introduced, so they have a basic understanding of where public health authorities come from and legislation come from. And so I do think that if there's any opportunities to integrate any of this into the academic setting, I would love to be part of that discussion.
Dr. Rustin, I had a question, even though I'm the moderator, but in Ohio, where I came from previously, they didn't have this thing called crossover day as we have in Georgia.
Mhm.
So in public health, is everything, if it's not advanced past the crossover day, if you have a public health policy that you're introducing, does it fail that day if it's not through the legislature?
If it's a bill that's being introduced, excuse me, if it doesn't cross over by the 30th day, that bill is essentially dead for this legislative session. Now, there's all kinds of workarounds, and these we have to watch things very closely. So, for example, if you have I'll give you a real world example actually. We had a bill a number of years ago that we were trying to get passed. It had to do with tanning facilities, indoor tanning facilities. There was really no standards around indoor tanning. And what the goal was to reduce skin cancers. And the bill that we were trying to get passed didn't make it past the 30th day. It died on the vine, basically, because it didn't make it out of committee. However, a diabetes bill did pass. And the legislator that was trying to get the tanning bill talked to the legislator that introduced the diabetes bill, and he allowed that tanning bill to be attached to the diabetes bill. It's a little mechanism that's sort of a workaround. And so even though the bill didn't get passed, a portion of the bill got carried into the diabetes bill. And it happens often. It happens more often than you realize. And so if you ever are reading a piece of legislation and you're reading about one topic and all of a sudden there's another topic that just doesn't really make sense on why it's there, most likely that was a rider. It got added to another bill that passed so that your bill still has a chance of making it. But there is political pressure to do that or not, because here's the problem. If the bill that you got passed is something that is supported by the governor and you feel confident he's going to sign it, and you add a piece of legislation to your bill, you don't talk to the governor about it, or the House or Senate leadership, they may decide that it's not something they're willing to support. And so you take a chance of losing your bill if you add another piece of legislation to your bill. And so there's a lot of behind the scenes maneuvers that happen when that type of situation happens. But getting back to your original question, technically, yes, bills die if they don't make it over the crossover on the 30th day, unless there's some of those maneuvers that happen behind the scenes. Did that answer your question?
Absolutely. And it's always interesting because states have different policies and procedures. So that's one that I was not familiar with, and I teach health policy. So I got to learn it. It's a different way that we do things in Georgia. But I didn't think about that rider opportunity to link your issue to one that's already through.
There was, just to give you an example, at the end of last session, there was one bill that probably had 4 or 5 different pieces of legislation attached to it. And when you're reading it, it's like a litany of different things. And you're wondering, how did this happen? And that's how it happened.
With time, we're at quarter till, and I know you have another meeting to prepare for. If there's any additional questions, I can entertain we have time for maybe 1 or 2 more questions. If anybody has any questions about academic health departments, they can reach out to me. The Coastal Health District's academic health department has been really great to see emerge and develop and grow in partnership with the Jiann-Ping College of Public Health. Through academic practice-based research, we can make a tremendous difference. Could we have the recording of the presentation? Absolutely, yes. We can provide the recording of the presentation to anybody who needs it. Just let me know, and I'll check in with Angie Peden. So Angie is normally here. She's the person that keeps my life in order from the academic health department perspective. So if there's no other questions, I will ask for a round of applause. And thank you so much, Dr. Rustin, for all your good work.
Thank you.
And there's a number of notes in the chat thanking you as well. And we'll be having some more of these throughout the year. So stay tuned, and thank you all for joining us today.
Yeah, thank you for having me. And I really appreciate the platform to be able to present on this topic.